has been value-driven, and it's been a function of a battle between two values. And the first of the values is the value of equity, the attempt to get, what I will argue, the most precious of social services, medical care, to the maximum number of people. That's what you're arguing for, okay, by your statement about moral whatever. We should have universal access to health care. The thrust towards equity in our society has played itself out to expanding financial access to health care, even though we have, suboptimally as it may be, access to community health centers, hospitals, etc., etc., etc. Now, in our political dualism, the Democrats are classically focused here, and when the British and the Canadians put their health system together, they put all their emphasis here, forgetting about the second value underneath the piece of paper, which is the value of efficiency. How do you get an appropriate amount of the most precious of social services, the appropriate number of people? And these things have been constantly at war with each other. Okay? Now, I want to talk about medical care as the most precious of social services, enormously important. It's even more important as a social undertaking than education. And again, coming from family educators, I value education enormously, and being involved in it at Northwestern, hugely important social enterprise. In fact, I will argue education is the answer to all our inner city needs. You go to school, you stay in school, you learn skills in school, you're rewarded in the marketplace for using those skills. Study American history. That's how everybody who came here has done well. Okay? Nobody said, hey, standing on the East Coast, hey, Italians, come on over, or Jews, why don't you come? We're going to make you rich. Or standing on the West Coast, hey, Chinese over here, or Japanese, why don't you come? We're going to make, it didn't happen that way. Okay? Everybody came here, dealt with discrimination of the various sorts that they had to go through, and education became the vehicle that made our society the social mobility success it is, with one significant exception at the moment. Education is enormously important in social undertakings. However, I believe medical care is even more important. My decision will, for the belief that medical care is even more important than education, is my belief that it's very hard to learn if you're dead.